The Zika virus was first discovered in 1947. It was identified in a monkey in the Zika forest of Uganda, which is how the virus got its name. The first human cases of Zika virus infection were reported in 1952, in Uganda and the United Republic of Tanzania. The Zika virus syndrome infection primarily occurs through the bite of infected Aedes species mosquitoes, notably Aedes aegypti and Aedes albopictus, which are daytime active carriers. These mosquitoes are also known to transmit other diseases like dengue and chikungunya. Apart from mosquito bites, Zika virus can also spread in various other ways. A significant concern is maternal-fetal transmission, where a pregnant woman can transmit the virus to her fetus during pregnancy or near the time of birth, potentially causing severe birth defects such as microcephaly and other serious brain anomalies. Sexual transmission of the Zika virus is another route of infection. The virus can be spread from an infected person to their sex partners through vaginal, anal, and possibly oral sex. This mode of transmission necessitates protective measures, especially in areas where Zika is prevalent. The risk of Zika virus transmission through blood transfusions has been reported, although it is less common. This possibility necessitates vigilance in blood donation and transfusion practices, particularly in regions with active Zika virus transmission. Lastly, there's a risk of Zika virus exposure in laboratory settings. This underscores the importance of proper safety protocols and measures to prevent accidental exposure to the virus in research and diagnostic laboratories. Overall, while mosquito bites remain the primary transmission route for Zika virus, the potential for it to spread through maternal-fetal transmission, sexual contact, blood transfusions, and laboratory exposure highlights the need for comprehensive prevention strategies. Zika virus syndrome typically presents with mild symptoms, which can be similar to other viral infections and usually last from several days to a week. One of the distinguishing features of this syndrome is that many people infected with the Zika virus may not exhibit any symptoms or only show very mild ones. The common symptoms include a mild fever, which is not always present. Accompanying the fever, there often appears a rash, which can be widespread across the body and may cause itching. Joint pain, particularly in the small joints of the hands and feet, is another frequent symptom and can be accompanied by swelling. Conjunctivitis, characterized by red eyes, is also common, but it usually occurs without severe pain or discharge. Muscle pain is another symptom associated with Zika virus syndrome, where individuals experience generalized muscle aches. Additionally, a headache, typically mild to moderate in intensity, can also occur. It's crucial to note the serious risk Zika virus poses during pregnancy, as it can lead to severe birth defects and complications. Although less common, Zika virus can also lead to neurological complications in some individuals, including conditions like Guillain-Barré syndrome, neuropathy, and myelitis, which are more serious aspects of the disease. Due to these risks, particularly for pregnant women or those planning to become pregnant, it's advised to seek medical attention if Zika virus infection is suspected. This ensures proper care and management of the condition. Treating Zika virus syndrome is centered around managing symptoms, as there isn't a specific antiviral treatment for the virus. The key aspects of treatment involve supportive care measures. Adequate rest is crucial for recovery from Zika virus infection. The body needs time to fight off the virus, and rest can help strengthen the immune response. Alongside rest, staying well hydrated is important, especially if a fever is present. Drinking plenty of fluids helps maintain hydration and assists in the body's overall recovery process. For pain and fever, over-the-counter pain relievers and fever reducers, such as acetaminophen, Tylenol, can be used. These medications help alleviate symptoms like headaches, muscle pain, and fever. It's important, however, to avoid aspirin and non-steroidal anti-inflammatory drugs, NSAIDs, until dengue, which presents with similar symptoms, can be ruled out to avoid the risk of bleeding complications. During the first week of illness, when the Zika virus is present in the blood, it's essential for those infected to prevent mosquito bites. This helps stop the spread of the virus to mosquitoes, which can then transmit the virus to other people. For pregnant women or those planning to become pregnant, careful monitoring and regular follow-up with a healthcare provider are advised. Given the risks associated with Zika virus during pregnancy, specialized prenatal care is important. Currently, there's no vaccine for Zika virus, so prevention largely relies on avoiding mosquito bites in areas where the virus is prevalent. This includes using mosquito repellent, wearing protective clothing like long sleeves and pants, and staying in environments with air conditioning or protective screens to keep mosquitoes out.